This study was titled Short and Long-Term Results Following a Standard Fracture Repair in 34 Horses. Standing fracture repair is a form of surgery that is done using just local anesthesia instead of general anesthesia, so they just numb the affected area, usually the leg or hoof. It is important because there's lots of research being done with it in thoroughbreds due to the fact that they usually sustain a numerous amount of injuries during the racing season. It's also important due to the fact that these racehorses develop all kinds of side effects to general anesthesia, and it would be nice to have a different route other than the general anesthesia so that they can avoid these things. The project used 34 horses and compared the horses that got hurt that were repaired, their fractures were repaired using standing fracture repair, and they compared the ones from Rosdale's University. Those are the ones that had general anesthesia, and they got knocked out for the entire thing. Some basic concepts: they, like I said, use data from Rosdale's Equine Hospital for the general anesthesia operations. They didn't actually do these operations at the same time as the standing fracture repairs. They just used the data that they had collected from these general anesthesia horses. The three different fractures that they used were the proximal phalanx, third metacarpal tarsal, and the medial condyle. These are the three most frequent forms of fractures that thoroughbreds and Arabians get during their racing career. Like I said, general anesthesia horse patients regularly develop gastrointestinal problems, which is really common because of the stress that they go through and the change in environment during recovery. It is really likely that they're going to develop, stomach problems. Anyone would experience stomach problems if they were put through that kind of stress of general anesthesia. 3 out of every 4 horses that they used from the Rosdale's Equine Clinic developed gastrointestinal disease. These are really high rates. So these horses were not used in the study comparing the actual time for recovery between the general anesthesia and the standing fracture repair horses, because that would be too many variables for them to compare. But it's just interesting to see how many of those general anesthesia horses actually developed a gastrointestinal disease compared to the standing fracture repair horses. The standing fracture repair was done with 1 surgeon and 2 assistants. One of the assistants would hold the drill hose, and the other assistant would hand the surgeon the instruments as he needed them. Just a basic procedure. Of course, drapes were placed around the horse's hoof and on the ground just to keep any dirt, manure, or debris out of the surgery area so they could decrease the risk of getting an infection and try to maintain a sterile environment as much as possible. They also used a nerve block, of course, to numb the area before they started cutting and actually doing the surgery. This is the biggest difference between standing fracture repair and local anesthesia. The horse is actually able to stand up during the procedure. They're just sedated. With general anesthesia, they would be obviously restrained and lying down. This is some data for the general anesthesia horses. The proximal phalanx for general anesthesia used a total of 19 horses, and the time between they had the surgery and their first race was around 10 months, 9.9 months. And with the third metacarpal fracture, there were 16 horses, and it took a little bit longer for them to get back to racing from their surgery, about 10 months. The standing fracture repair, however, with the proximal phalanx, there were only 14 horses used. However, the time between their surgery and their first race was 9.1 months. That is significantly lower than the 9.9 months that you saw on the previous slide. The same goes for the third metacarpal fracture site. 13 horses were used, and the time between their surgery and their first race was only 6.2 months. Now, for the racehorsing industry, those racehorse owners want to get their horses back to racing as soon as possible. So this could be a really good benefit for them. If they could decrease those months by, 2 or 3, that would be a significant advantage of standing fracture repair over local anesthesia. So my conclusions are that standing fracture repair can be a good alternative to general anesthesia due to several reasons that I've mentioned. The gastrointestinal disease, there's less risk of that, and also they can get back to racing sooner, and that's the main goal for their owners. However, it does have some limitations. The horse has to be calm, cool, and collected during this procedure, in which most racehorses aren't, but I think that if you just work with the horse and provide a calm environment, this can be overcome. Because obviously the horse is standing up and the surgeon is having to operate on them, so they're going to have to be standing still. And these are my sources. Thank you for listening.